Dr. Abhishek sir is Abhishek sir.
हाँ जी सर.
हाँ जी सर, वेलकम कर दीजिए सर का.
Good morning everyone. Good morning Dr. Venkat.
Sir, good morning sir. Good morning Abhishek sir.
So friends, today we have a very learned person with us who will be taking our class. He is Dr. Venkat Chaudhary. He is MD in homeopathy and assistant professor, head of the department in surgery department in Sasa Homeopathic Medical College, Bellary, Karnataka. So without wasting any of the further time, I would welcome Dr. Venkat Chaudhary to take up today's class and enrich us, all of us, with his mind-blowing knowledge.
Sir,
Welcome, sir. Please.
thank you. Sir,
Welcome sir.
thank
Welcome.
sir. Thank you Abhishek sir for making me introducing everyone. So this is very small case sir. So very hot. Good morning everybody. That means here very hot days are running here. So welcome and thanks to everybody for bearing me this session. I think I will make you happy and this evening also helpful for you. It's no doubt. Though our organ of medicine, written by Hahnemann, warns as our teachers, don't be prejudiced mind person, but our ordinary, our micro brain always feels inferiority at some points. You know, in our clinical practice, sometimes we lose our confidence by our pre-results of some of the cases, by our own experiences or by some other person's experiences. Usually we used to get some of the bad experiences. We develop some of the negative opinions over the cases. This case will not be possible. This case will not cured. This is incurable case. So that the same thing I developed in my practice some of experience by the sum of experiences of some cases. So this case, among those cases, this is one of the example in my practice changed my view after I came into the SSH, this mind method case taking, changed my opinion in homeopathic efficiency also. So at some cases we have to take some points, we have to give some points very importance, and in some cases we have to give importance to the some other points. But in this case, what will be the case? I will show you. The case begins. This is a case of vitiligo. You know the vitiligo, depigmentation, white spots over the body, anywhere it may come. But in this case, vitiligo, white spots over the foot and foot borders, over the dorsum of the foot, and just near behind the right lateral malleolus, a longer one. That means the spot is very longer one along the border of the where the dorsum of the foot meets the sole of the foot. In front of the left medial malleolus, and small white spots all over the foot. So this is the actually the patient presented in front of me. He came for the vitiligo treatment. The description of the case, the physical points of the case, this is. But here, for the spots, there was no itching, no complaints, anything. This is we called one-sided cases. usually if there is absent of sensations usually and modalities also. You can't get uh, more points in these type of cases usually. So what happens next? So before the treatment, this is the video. Actually, I lost the video. So I will show up the video also, no problem. Actually, the video I have taken at the second consultation only. Video after 1 month of first prescription, I have taken. Why did I taken that video? I will explain it later. So due to my inferiority, lower confidence over this type of cases, I did not make first video actually, because I have no confidence in treating that cases. Usually I used to take every skin case with the camera. First of all, whatever may be the case, I have taken. But in these type of cases, vitiligo white spots cases, I have no confidence. So I did not take any video in the first consultation. But trial and error basis, I prescribed the medicine. Trial and error. So patient came and a patient asked for that only. I have taken the case and I prescribed the medicine. But over my prescription, I have no confidence. The person or patient was 38 years old male person, visited to my clinic for his vitiligo complaint. He was one of my old patients. Previously, he visited my clinic for some other complaints. After a long time, again came to my clinic. In previous consultations, there was no skin complaints. But after 3 or 4 years after, he came to my clinic for his complaint, this vitiligo complaints. Earlier, he was with some cold-like symptoms. I treated for the cold symptoms. But this time, exclusively, he came to my clinic for the vitiligo complaint. So, patient's present complaint: white spots have been developing over his foot. That means this is the patient's narration. I have written here: over my foot since 3 years time. There are spots at some part of the foot and linear like spots at somewhere of my foot. So over the dorsum of the foot, there are some spots in round spots. At some places they are linear, that means long in shape. And the lateral border of the left foot also, and heel region also depigmented. For this reason, to control them, to control the spots, because they are at the dorsum of the foot. If they come up, if they approach the leg and thighs, it will come over the body. So he has that thought at that time. So he came here to control them, to stop them to the dorsum only, or to cure them. But by my sayings, after case taking, he agreed to, sir, please stop that spots to the dorsum of the foot only. Give the medicines to stop there only. If you are saying you have no such medicines to clear that vitiligo, but what happened after the prescription of the medicine? We will go to the discussion. So, what was the reason? I asked in the case taking, what was the reason as per you? Why I asked this question? As per you, this question I usually ask to the patient to know the probable causative factor in the perspective of the patient. Usually in the case taking, we interpret the causative factors. For this reason, he might have that problem. He might get that problem. For this reason, we analyzed the case and we took that causative factor as per our analysis. But usually in case taking, I asked, what was the reason as per you? Usually they have some delusion kind of rubrics. We will get delusion kind of rubrics here, and to delusionary ideas in them. Here usually I don't use regular medical causes. As you know, our homeopathy does not have much importance to the pathological causes. You know, sir, vitiligo, for the vitiligo, depigmentation, melanin pigmentation, decreased melanin pigmentation, all are the pathological factors, you know, the causative factors also, why melanin pigmentation is decreased. So here I left all those pathological reasons, and I want to know the perspective of the patient causative factor, in the sense of causative factor. So usually we go to the dynamic causes in homeopathy. So that then the patient narrated this. I think you need everything because of he is an old patient. I know the family background, his personal history, everything I know. But again, I asked the same question: what was the reason you got this problem? So, may delusionary ideas may come out from the patient. So he started to narrate like this: Sir, you knew everything about me, doctor. My two kids are artistic. For their school training, my family shifted to Mysore. Mysore is the town in the Karnataka, or city. It is a big city in Karnataka, far away from my native, the patient's native, where institution is available for the artistic children. With my kids, I shifted there. There, I struggled more with the kids because male and girl and boy both are artistic. You know the artistic children, how they behave. They are mentally retarded. They don't know how to eat and how to walk also, how to bath also. They don't know how to drink also water. So every time I must serve, I must be with them only. So there, with my family, me and my wife, with the kids only, I shifted to that Mysore for the institution to train the artistic kids. There I struggled more with the kids, thinks that what will happen to them. Me and my wife alone, only caretakers of both kids. So here in my native village, I left all my agriculture lands and my own house for the sake of my kids' treatment. Managing artistic kids was a big challenge there for me. There I studied a course about artistic management for my kids, but I have a painful feeling from the thing leaving everything, the agriculture lands, my relatives, my parents, and my own house, everything I left in my village. It was a painful feeling for me. So this is the mental status of the patient. I left everything in my life to care them, my kids. I'm caring my kids and my family only. I'm living for them only. Managing artistic kids are very difficult thing, but I'm managing at best of mind. So here he's struggling now, and he was struggling. He has been struggling some years since the birth of their kids. Both kids are artistic, so there was a pain fulfilling in them, in him. So this is the case. Sir, can anybody say what will be the analysis according to you? Hello? Hello.
Anyone can
Can anybody?
inputs?
Shall I go?
I think continue.
Sir, he is taking lot of pain to take about the future of the children. Means he has shifted so far for the children, and he is
Yeah.
trying to adapt whatever difficulties are there. Is trying to solve the things and help the children to grow up. Whatever is their good for their future.
Yeah. As per you, you are right, madam. Everything he is doing now for the children only. But the causative factors, we have to search for what were the causative factors for the developing this vitiligo. I have seen many cases, the persons who are suffering, who are facing more stress in their life, in their kids only. I have seen almost 3 or 4 cases in my relatives and in my friend circle who are facing the more problems with the kids only. This type of vitiligo spots, the generalized vitiligo spots all over the body, very speedily developing vitiligo spots I have seen. So, shall I go? Is there anybody, sir?
Sir, one rubric can be indifference to recovery, as he doesn't want to get rid of the spots. He just wanted that the spots should not grow more bigger. वो वहीं पे stable हो जाए,
Sir,
इतना ही उसके लिए बहुत है.
your voice is not clear.
Hello, am I audible, sir, now?
Yes, sir. Yes, sir.
Sir, I consider indifference to recovery here, sir. As he said that my spots should not increase. वो वहीं पे stable हो जाए, ठीक चाहे ना हो, लेकिन वो यहाँ से बढ़े ना.
Sir, you are right. As per the narration, the 3 years, since 3 years he has been suffering with this vitiligo, but it is not indifference. It is more. He has given more importance to the kids than his disease. He has the thought. He has that vitiligo spots, but to come and meet the doctor, there was no time. And actually, after 3 years, the training was over. The kids are going to the school. That kids are going to the school, so there will be time. So he came to meet me for his treatment, so that there was no indifference. He has the idea to take the treatment, but there was no time to meet the doctor and to care himself only. The total care about the kids only. So that I narrated that I left everything in my life to care them. Okay.
Hello, sir.
Sir, madam.
हेलो सर.
Sir,
बोलिए मैडम, आप बोलिए पहले. हिंजल मैडम बोलिए आप.
yes. सर 3 years से ये पेशेंट आपके पास आ रहा है और अभी 3 years में इसने कभी भी मेंशन नहीं किया कि मुझे प्रॉब्लम है, बट अभी जब ये प्रॉब्लम अपीयर हुई है और वो बढ़ने लगी है तो उसने कहा कि ये यहीं पे रुक जाए, बस इतना होना चाहिए. तो कहीं ना कहीं मुझे एक फियर एक्स्ट्रावेगेंट का फील आया, बट उसके साथ अगर हम दूसरी हिस्ट्री देखते हैं तो मुझे वो जो कह रहा है ना कि सब कुछ मेरा वहीं गांव में रह गया है, तो मुझे ये थोड़ी सी होम सिकनेस वाली फीलिंग है और एलिमेंट्स फ्रॉम केयर्स एंड वरीज, और तो फिर मैं कॉक्यूलस की ओर भी जाऊंगी. तो सर ओपियम एंड कॉक्यूलस.
Nice. Okay. So,
सर मे बी वो एलिमेंट.
some families, for this reason, I have seen some families. The father role, I'm not talking everybody, but father role after 2 kids born with the artistic mind. The father role, usually they become drunken, they become irresponsible, they avoid the children to see, because both are artistic children. But in this case, he has very much patience. He has very care about his family. So that is a different. So that point I looked carefully. Usually the behavior, male's behavior than the mother's behavior. Usually the fathers, they do like this, that they are not taking proper care about their kids because both are artistic. This is not, I'm not talking every father, but maximum in society, the male, the father role behaves like this. They are very less taking care about their kids that are problematic kids than the mother. Mother is the very caretaker in case of this type of kids. I think you know this point. So I have considered some of the rubrics here, but at that time, whatever may be the possibility of the curability of the case, I have taken the case strictly, and I prescribed the medicine, but without confidence over the curability of the case, not over my medicine. Okay. So these are the rubrics I have taken. I have considered these are the major states in this case. Ailments from responsibility. What does it mean, responsibility? Taking everything into the consideration. If the kid is suffering with some ailment, or means if a kid weeps, he must arise. He used to arise and serve them according to their suffering, whatever may be. He has very responsibility over the family, because I already said the father role is very negligent, might be the negligent in some of the cases, but mother role is the very careful in this type of cases. Here he did not show any type of negligence over their kids. I observed so many times him. He has no entertainment in his life. No entertainment. Every time he thinks about their kids only. So this was this character led me to take ailments from responsibility and ailments from homesickness, as the madam already said, and anxiety from ailments from anxiety prolonged. Because what will happen to the kids, since so many years he has this type of mind symptoms, that the anxiety, this type of emotions. So I have taken into consideration these three states as the causative factors. So the medicine, anybody?
Carcinosin, sir?
No, madam. Aramate.
Aramate.
Yes, Aramate, because he has a strong mentality around his duties, usually duties. So I have prescribed Aramate 30 potency. After 30 potency, he visited my clinic with the pigmented patches. All the small spots are filled with the pigmentation. So I have used in this case 3 types of potencies, almost 30, 200 and 1M. I have not taken any other rubrics into consideration because at that time I felt these are the 3 states are strong, and I have no confidence in this case to case curability, not over my case. So I have not taken other rubrics into consideration. The vitiligo spots, it is the clinical rubric I have not taken. So only the psychological state, what he suffered, what he carried in his life, only I considered here. So results. In second consultation, after 1 month, all small white spots disappeared over the foot, dorsal surface of the foot. Later, in following consultations, big spots started to get deep pigmentation. So after 1 month, I surprised by looking over the spots. All are vanished. He came after 1 month because monthly once he has taken the medicine because of kids problem was there. So this is the third consultation. The spots, the videos I just I will show it in the so this is the third consultation. This is the fourth consultation. So here so videos are I will show it the videos in the laptop only. Just I shifted to the mobile in the mobile. So this is the actually this is the scar. Wow, the scar also there was white spots. So this is the final result. I will show the before treatment videos also. So here the point is, why did not I take first video or before treatment video? I don't have much confidence in treating vitiligo cases. If the vitiligo spots are at non-hairy parts, usually non-hairy parts, because the meeting dorsum of the foot at the sole, that was the non-hairy part. So where the vitiligo spots comes at the non-hairy parts, regions like lips, foot and hands and palms, fingertips. So that will be the difficult cases, incurable cases. I was a thought, I have a thought like that only. I have given the medicine just trial and error based. I have confidence on medicine but not on the curability of the vitiligo. But this case changed my opinion. Once I got the result, I captured since the second consultation. So what is the philosophy of the case? So what I learned from this case? In one case, you can have multiple causative factors. Here I have taken 3 causative factors. One is the responsibility, one is the homesickness, and one is the anxiety prolonging. So usually we think one causative factor for one case, but I have taken here 3 causative factors. Yes, we can take multiple causative factors in our cases. Causative factors, ailments from. Okay, next. Earlier, I supposed like this vitiligo cases where there is less hair, non-hairy parts like lips, where there is less blood circulation comparatively to the other parts, they would come difficult cases. They won't produce melanin pigmentation as expected. But this case proved me wrong. His dorsal part of the foot and borders of the foot regained their melanin after the medicine. In one-sided cases, where all physical symptoms with no modalities, sensations absent, mind method is the best suitable, especially causative factors helps a lot. So this thing I got from this case, where one-sided cases and where the physical symptoms are absent, where the sensations are absent and the modalities are absent, the mind method is the best way of treatment, way of to select the medicine. So this thing I got I got from this case. So I will show
small spots and white spots after first consultation. So this is the
Sir, we can see in your video, but your voice is not proper.
अभिषेक सर का बंद कर सकते हैं माइक आप अपनी तरफ से
how. Hello.
Yes, sir.
Continue.
Yes. Sir, here in this case, the before treatment, after first month consultation, is saying all my white spots are covered. Very small spots. The action.
Sir, sir, please use your mobile, not your laptop and earphone. We see your follow-up total video and continue with mobile, sir.
Okay, sir. Okay. Hello.
Hello, am I audible, sir?
Yes.
Yes,
sir.
sir.
So there were those were the follow-ups. In the first follow-up, I actually I have no expectation to cure this case. But second follow-up, he has told me all small spots are over, but behind the malleolus, what are the lateral malleolus, big patches were there. That is become to covering, and the scar also over the scar, the deep pigmentation also becomes pigmented. So this case is a very successful case in my practice, because I have not in the case of patients, but I have changed my opinion in treating such type of cases. This is the thing I have to express before you. That's over, sir. This case is over. So only RMET, with the only RMET only I have treated this case. No other medicines at all. Now treatment is over. The patient is very happy. He is with their kids. He's not coming regular follow-ups nowadays also because of kids.
Sir,
That's
can you
the-
share the potency and the repetition?
Madam, every time 30 potency and 200 potency, sometimes I have given the medicine every third day one dose. Every third day one dose. Any potency, every third day one dose. But 1M potency, monthly one dose for some months. Monthly one dose is enough. Because
Okay, sir.
when the case is responded with our medicine, the repetition, no need of much repetition. the repetition also has some psychological factor of the physician, because of medicine may not act if the improvement stops. That fear pushes us to repeat the doses. Actually, one dose, or if the result comes, if the result starts, one dose is enough. When the patient is absent in front of you, he is not coming regular follow-ups, he wants to take a long time medication, then our mind thinks that if the case progress stops, what will happen? So that I advised him to take every 15 days one dose. That's the reason I have prescribed, because that dosage, repetition of dose is also not necessary when you get the improvement. Nowadays, I am strictly following the restriction of the doses also.
Sir, very excellent case in vitiligo. But sir, please describe again on metillicum rubrics in little detail for us, for beginners. You take.
Madam, Aramitalicum rubric, I have not prepared Metrimedica here in the form of rubrics, but I have one idea about the Aramate. He has very duty-minded person, responsibility, has very responsibility like our, in any department, who are doing very sincere duties. I have that thought only. If anybody, anything, we suspect them. We suspect in the means of bribing, in the means of the illegal activities, if in the means of, we suspect their sincerity. If we have the other person have any doubt, immediately they will get depression. Immediately they will get depression. Immediately that depression pushes him up to the suicidal level. This is the core point. Until and up to, he has very brave mind and he has very ready to take challenges. He put all his efforts in doing the things what he wants to do, and what he in the departments like in government also, or in the task challenges also, what he that means I'm not getting the right word, what he allocated to do that things. So in those cases, in that cases, he put a very sincere effort to take to get the results. If any suspicions, any insult or any degrading comments comes, immediately they will get depressed. This is the thing I have in my mind about the Aramet, madam. Any person, any doctor, senior doctors here, you can share your experience, Aramet experience with the rubrics, as madam asked us.
हेलो सर.
हाँ मैडम.
हाँ सर, इसमें एलिमेंट्स फ्रॉम केयर्स एंड वरीज अबाउट चिल्ड्रन, या फिर मैटरनल इंस्टिंक्ट एक्सैग्रेटेड, ये रूब्रिक्स क्यों नहीं लिए? मतलब हमारे माइंड में
madam, if we take many rubrics as per the narration, we following the narration, almost 30 rubrics usually we get in one case. We have to filter what is the core point, what was the exact cause for this element only. If we take since childhood, in every case, since childhood, if you ask the questions, nearly 100 rubrics in one case we might get. So we can take cares and worries, but the causative factor for the ailment, not about his state of mind. I didn't go for that in this case. only the causative factors. What were the causative factors? What was the life situation there? So in case we have to restrict for some place for the complaint related only, madam. Complaint related only. So if you take all the desires, he has some curd desire. We can take curd desire. Everybody has emotions like anxiety, fear. Every person carries some of the emotions in their life. If you take all the rubrics, usually the confusion will come out. That is my answer. In that case, I didn't go that much of depth. Only I related to that case what were the main causative factors. I picked out the rubrics and I selected the medicine.
Thank you, sir.
I think many persons have their own ideas, but in my case, I don't go much rubrics. I studied at somewhere one famous physician, right? You don't take rubrics in one case more than 10. If you take more than 10 rubrics for the case repatriation, case is watery. There will be no case. You will get easy confusion. The strong points you must take. If you limit the case, the 5 rubrics to 6 rubrics, the consolidated rubrics, your case will be successful, no doubt at all. Ask me very English things. I don't know Hindi much, but I don't.
No, you will have to sweet him in the coffee, Venkat, otherwise. Cold coffee, otherwise. You will have to send me cold coffee.
Okay, sir. Okay. Madam,
Okay.
ask me.
Please
No problem.
please
If at all I know that answer, I will tell you.
No, because I want to learn, Venkat. It's that
Yes, yes.
I want to learn. See, it's not that we are great something. It's just that we have studied more. Just that God has blessed us with little more understanding. But we are here to learn, Baba. We are always a student. You know?
Yes, sir. Yes.
Please ask sir. If he finds difficulty, I am there to help.
Okay, sir. Okay. Someone is asking some question, madam.
Hello.
A
Hello.
small query. A 9-year-old little girl, very fair, fat, flabby. I prescribe have vitiligo symmetrically both eyes, upper eyelid. Then I gave him area calf on a very fat girl and 3-4 sisters. Then no result. Then I inquired again. She told only.
So I have observed 2 types of this pigmentation, madam, in vitiligo cases, but I don't know how to interpret here the Herring's law. Is the center to periphery, periphery to center? I don't know.
Yes.
Which is the
eyes are recovering, sir. Eyes are recovering from vitiligo. Whole are recovering. Skin become normal.
actually I didn't get, madam, what you said me, madam. Is that case cured?
But vitiligo patches are in symmetrical way. Eyes in symmetrical way, and knees on small spots are in symmetrical way. Eyes are recovering, but knees, as per her mother, it is growing.
Okay. As per you, eyes are covering first and knees are later. You are telling that Herring's law is approaching or not?
Yes, sir. Yes, sir.
It is just by observation only. You can tell, madam. We also.
Sir, I am confused that medicine is right or wrong. I don't know.
Whatever maybe the initiation has started. That is the first thing. Initiation, the pigmentation has started. That is the thing happened here. Just wait and watch. If the patches are enlarged, then the case is that medicine is wrong. Until and unless the patches is covered and the progress is the progress stopped, we can't say what is happening there. And the generals also, we have to observe the generals. Is there anything happen in the generals also, the weakness, energy, like what we said, the generals are improving or not. So the eyes are first covered. Is it okay? Okay, we have just to wait and watch, madam. Why do you want to change the medicine? Is there any idea to change the medicine?
No, sir. Medicine almost right, but I don't know how I gave him placebo this time only. And
okay, wait and watch, madam. Vitiligo cases you can't cure within the 15 days or 1 month, madam. It will take minimum 6 months to get
yes, sir.
result.
The case is almost in 6 months. Earlier, I was giving Kenya, which from Kenya, I didn't get any result. But Pulsatilla, I got result.
Okay, madam. If you have confidence over your medicine and your case taking, the applicated rubrics are right, and medicine was right. Just wait and watch. Nobody can say the vitiligo cases will be over in the 3 months or 6 months or 1 year. If the improvement is going on or improvement is stopped, then only the repetition of the doses, any intercurrent remedy, as Lekats are stated, there is any multiple diseases
Yes, sir.
like syphilis.
Lekat sir said that syphilis.
Yes, yes,
The
yes.
vitiligo spots are in symmetrical way. So I thought that maybe syphilis.
Madam, the interference of intercurrent medicine also, once you stopped at point, then only you have to put the intercurrent medicine. Unless and until that there is a demand, you don't get any type of medicine with the you selected medicine.
Yes, sir.
Yes, yes, and don't.
Thank you.
Thank you, लियाकत भाई, आने के लिए.
Sir, thank you. Thank you.
Thanks to all participants.
I came late.
Sir.
I am sorry I came late. Actually, I should have joined a little early.
Some disturbances has happened. Please excuse me. This is the first time I came into the Telegram chat. Please excuse me. And thank you for bearing everybody. Thank you, sir. I'm leaving.
Venkat,